is fast becoming one of the leaders in telehealth.
Over the last 4 years, NHS Direct and NHS Birmingham East and North have been providing their patients with the UK's first large-scale telephone-based care management system, known as OwnHealth. I caught up with John Grayland, Senior Strategy and Redesign Manager for the PCT, to find out how that and a new assistive technology programme has been rolling out.
We like to think it's going from strength to strength in terms of members. We're now up to about 10,600 members. We're expecting to get to 11,500 by the end of March or beginning of April. That's our target for the year, and we think we'll make it just about. After that, because we're not sure about the future of it past the next year, we're actually not going to be recruiting in big numbers next year. You may be aware we had a procurement exercise. We went out to tender last year. That didn't secure us a new provider. What we've decided to do now is we've decided to have a 1-year extension with our current providers, who are Pfizer Health Solutions and NHS Direct, and we've negotiated a 1-year extension with them. We're going to use that year to consult the emerging GP consortia about what is the long-term future of Birmingham Own Health and what exactly do they want to see. Do they want to change the specification or anything?
And in terms of adding on assistive technology, which is why we're here today, can you just tell us a bit more about how you've been doing that and how it links to Own Health?
Yeah, sure. Assistive technology has been a great addition. We've been using it for about 2 years now, slowly building it up. We've had about 260 people use that. And essentially that, rather than just being able to ask people, normally on a weekly or monthly basis, how's the blood glucose going or how's the blood pressure, we can put a monitor in people's homes that can give us a daily reading. So daily we can know what somebody's blood pressure is, say, or oxygen saturation. That's an extremely useful one for people with COPD. And when we know that daily, that enables us to give that person lots more detailed and better advice, but it also helps us to predict when there might be a hospital admission or an episode that might lead to a 999 call or something like that. We have been monitoring the people who've had these machines in, and what we do, what we can't do is construct a very sensible control group. So instead of doing a control group trial, what we've been doing is looking at the patient's records for 12 months before they had the monitor unit and 12 months after. And what we've discovered there is that we're getting something over 80% reduction in hospital admissions on the before and after comparison. And that's very significant. I mean, I know we've got 74 patients who've had those units for over a year in their home. And across those 74 patients, we're looking at savings in excess of £300,000 in hospital admissions. So, if we get to 200 people with those, we're going to be talking about 700,000-800,000. Maybe soon we'll be heading towards like £1 million saved by putting these monitors in people's homes.
Mm-hmm. And both you and your chief executive have emphasised, scaling up and the benefits of scaling up. When you talk about scale, how many people do we need on these kind of programmes to see real benefits?
You might say in Birmingham, between 50,000 and 100,000 people might benefit from the telephone service. Across the West Midlands, that may go up to 200,000 or something, could benefit from the kind of telephone services. I would suggest that probably 5% of them would also benefit from having the assistive technology in. Certainly operationally, I'd like to be growing the telehealth assistive, the monitors that we put in people's homes. I'd like to be growing that by 200 or 300 a year into people's homes. Now, whether we're going to see those kind of growth rates is very much dependent on the future shape of commissioning and the views that GPs take, because as you probably all know, with the bill that's been published that we think will become an act relatively soon and so on, under the coalition government, we expect to see GPs very much in charge of these decisions. So I'll be amongst the people trying to sell these ideas to GPs and convince them of their worth, but in the end it's going to be up to GPs as to how fast we grow.